Good evening, I'm Jim Williams. We begin with breaking news in the fight against COVID-19. The Food and Drug Administration has now authorized the use of an antibody cocktail treatment. It is the cocktail of drugs produced by Regeneron. Tonight, the FDA says it's okay to give it to some high-risk patients with coronavirus symptoms. It's the same therapy President Trump took when he had the virus. Regeneron says it will have doses for 80,000 patients this month and 500,000 before the end of January. Drugs like this cannot come fast enough for hospitals, which have had a steady rise of COVID patients. CBS 2's Jeremy Ross talked to a high-ranking healthcare executive in the middle of a crisis. Jeremy?
And Jim, the doctor we spoke with this evening believing things could get worse before they get better. He believes the upcoming Thanksgiving holiday could double as a super spreader event for the virus, and we are already at concerning levels.
I would say we're actually in crisis mode.
Dr. Ernest Wang, Chief of Emergency Medicine at North Shore University Health System, oversees 5 hospitals, including in Evanston and Highland Park. He says the COVID trends he is seeing in emergency rooms are filling up too many hospital rooms.
The numbers we have now are much higher than the numbers we had back in the spring. And with the numbers as they're climbing, the cases, we can only expect for the near term that these are going to continue to go up.
How worried are you?
I'm very worried. Our whole health system is worried. The patients are coming in more frequent and sicker, and it's not slowing down. So we just have to continue to try and manage the patients. We have not enough staff sometimes to staff the beds that we have.
Wang says they are not turning away patients who come in for other emergency care like car crashes or heart troubles, but COVID-19 is stressing their staffing to the breaking point. State of Illinois reporting more than 6,100 in hospitals with COVID-19, nearly 600 on ventilators. But that is up significantly from only 2 weeks ago. In that time, there has been a 45% increase statewide in COVID-19 hospitalizations and a 62% increase of the sickest patients with the virus on ventilators. Wang says the bulk of his patients aren't in that most critical group yet, but
the number of people requiring oxygen is astounding. And that group, which is, not quite ICU, but certainly not well enough to send home, is a big proportion of the current patients that we're seeing.
When those patients are hospitalized, the antibody cocktail Regeneron could be an option. The treatment has just been approved for emergency use by the FDA. Dr. Ben Carson, Secretary of the Department of Housing and Urban Development, crediting his COVID-19 recovery to the drug, posting on social media he was convinced it saved his life. That is also the same treatment President Donald Trump received following his COVID diagnosis. Wang says treatments like that are helping healthcare during the second surge, and there is more help on the way.
There is hope around the corner. The vaccine data news is great. And I think if we can just hold out, till the spring, we'll be in a much better place.
But it is going to be months before most of us can get one of those vaccines. In the meantime, the doctor reminding people out there to wear one of these, a simple mask. It could certainly help you, your family member, a loved one, and also help out those first responders, those healthcare workers who work in places like the hospital behind me. We are live outside the University of Chicago Hospital. Jeremy Ross, CBS 2 News.